The Cardiac Arrest Management Station is designed to test an EMT candidate's ability to care for a situation involving pre-hospital cardiac arrest by integrating the skills of CPR, defibrillation, airway management, and patient and scene management. A second rescuer is available to perform CPR. This station should take approximately 15 minutes to complete.
Any situation involving cardiac arrest can sometimes become overwhelming. It requires numerous personnel and equipment resources and someone with the ability to manage those resources effectively in order to save a life. Remember your ABCs and follow the prompts provided by the AED, and you'll do well at this station.
Candidates at this station will have the equipment, supplies, and additional personnel necessary to assess and manage a patient in cardiac arrest. Since AEDs vary slightly in their operation, candidates must be familiar with the device being used at this station. Equipment and supplies for use at this station include a mannequin used to simulate a patient in cardiac arrest, as well as an AED, supplemental oxygen, and airway and ventilation adjuncts to manage the patient. Medical exam gloves are included as part of the personal protective equipment. The main sections of the Cardiac Arrest Management Station involve assessment, transition, integration, and transportation.
This is the Cardiac Arrest Management and AED station. You've had an opportunity to check your equipment. Do you have any questions?
No.
If not, Patrick, begin CPR. In this situation, you have a patient that's in cardiac arrest with one person CPR in progress. Begin.
Begin the station by indicating that the proper personal protective equipment is being used. Size up the scene by briefly questioning the first responder about the events of the cardiac arrest. Direct the first responder to stop CPR and then reassess the patient to verify the absence of a pulse.
I'm taking BSI precautions. How long has he been down?
Less than a minute.
Stop CPR.
No pulse.
Once the examiner advises that the patient is pulseless, begin to manage the patient with CPR and the use of the AED. Turn on the device, attach the electrodes, and follow the prompts. Always make sure that everyone is clear of the patient when the AED is analyzing the cardiac rhythm and whenever defibrillation is performed.
Continue CPR.
Connect electrodes. Analyzing now. Stand clear. Shock advised.
Everybody clear? Shocking now.
Stand clear. Analyzing now. Stand clear. Shock advised.
Everybody clear?
Stand clear.
Shocking now.
Push to shock. Stand clear. Analyzing now. Stand clear. Shock advised.
Everybody clear?
Stand clear. Push to shock.
Shocking now.
Check for pulse.
No pulse.
With 3 unsuccessful shocks and the patient still pulseless, the rescuer should transition from defibrillation to CPR in an effort to move oxygenated blood throughout the body for 1 minute. During this time, the rescuer should also confirm the effectiveness of the chest compressions by the first responder.
Good compressions.
During this 1 minute, The rescuer should make certain that an airway adjunct, such as an OPA, is inserted and that the patient is ventilated through a BVM attached to supplemental oxygen. At the end of 1 minute, the AED will advise of the need to reanalyze the heart rhythm.
I'm inserting the OPA.
Okay.
Stand clear. Analyzing now. Stand clear. Shock advised. Stand clear.
Everybody
Push
clear?
to shock.
Shocking now.
Analyzing now. Stand clear. Shock advised.
Everybody clear?
Stand clear. Push
Shocking
to
now.
shock. Check for pulse.
After reassessing the pulse and determining that the patient is still in cardiac arrest, CPR should be continued and the rescuer should transport the patient.
Pat, continue CPR. At this time, we need to transport the patient.
Okay, you can stop.
With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. Items at this station that would result in failure include failing to take or verbalize the use of body substance isolation precautions, failing to evaluate the need for immediate use of the AED, failing to begin or resume ventilations and compressions at the appropriate times, failing to make sure that all individuals were clear of the patient before delivering each shock, and failure to operate the AED properly. This includes failing to deliver a shock when indicated.
Turn on the AED after determining that the patient is in cardiac arrest. The device will provide the necessary prompts for you to follow at this station.